Hello everyone, you're watching sqadia.com and today it will be osteoarthritis. We will be going through the general aspects in this section and the historical and the new classification. We'll be discussing it in details what is the basic form of osteoarthritis and how it actually affects a very large subset of population now, because as the population is aging day by day and there are certain countries where there are a lot of retired people, especially above 60, 65 or 70 years of age, and this problem has actually surfaced a lot in the older age group, and nowadays it's a very common occurrence that total hip, total knee, total shoulder replacements are going on throughout the world. So what is osteoarthritis? End result of a biomechanical and mechanical insults that exceeds the joint's ability to repair itself. If you see below, this is a diagram of a knee joint. Knee joint is something when we walk, we run, we jog, all the time the weight bearing is being done by hip and knee, almost an ankle joint. If something goes wrong, then the body has the ability to repair itself. But if for any reason the mechanisms to repair itself exceeds beyond the possibility and the insult is far greater than that, then what would happen, that body will not be able to repair properly. As a result, joint failure occurs, and this joint failure is basically termed as arthritis. And as the bones are involved in the joint, so it is osteoarthritis. Associated with age, common with old age people. And nowadays, why this problem is actually surfaced, because now the population which is aging is actually aging quite rapidly. There are fewer young men in Western countries as compared to the old people. So as the population is going to age further, the joint failure, which is the insult which is going on throughout the life, as the knee is taking load throughout your life when you're walking and jogging. So once it starts to fail, then it needs to be replaced. So the load, the economic load of these replacements, the hip replacement, knee replacements, is going to increase, and it's going to be a massive burden on economy and health budget. Mainly affects the hips, knees, spine, hands and feet. If you see closely, hip and knee are involved in weight bearing. Feet, mainly it's the ankle joint, then that is also involved in the weight bearing. If you see spine, actually the force of our weight is actually transmitted from lower spine to the hip and then to the knee and eventually to the ankle. So spine also gets deteriorated due to weight bearing. But why it's also occurs in common in hand? Because actually we are doing most of our work with our hands. It is especially hand osteoarthritis is common in those patients who have been either working a lot with their hands or have been a manual labor which has been completing or doing day-to-day tasks involving hand movements. Hip and knee are the most common. There is a high prevalence of pain and disability that they cause in older adults especially. Now, when initially this all surfaced out, there was a lot of classifications over osteoarthritis. Historically, or generally speaking, the classical classification was based on the mechanism how it happened. It was according to whether or not there was an obvious cause. So by this, they divided into primary versus secondary osteoarthritis. If there was no cause, there is no real cause to this osteoarthritis, and as it was mainly due to aging, that was termed as primary osteoarthritis. But if there was some kind of a fracture of the distal femur or proximal tibia, or any insult with further due to metabolic disease, then it was termed as secondary osteoarthritis. There's another classification in which they divided it this way, that whether symptoms are associated with joint damage or not. Now, this is important, that if a 70-year-old female comes to your clinic, she may be having a pain, problematic points when in knee pain associated with decreased range of motion and unable to bear weight at times, that there may be limp, but not necessarily she might be having osteoarthritis of the knee. But when you see x-rays at times, what happens is the symptoms are there, but radiologically it's a normal x-ray. And sometimes patient presents for some other reason, but when you get an x-ray, we see around on the x-ray is a highly deformed and damaged joint, but the patient is asymptomatic. So the one way of classifying this osteoarthritis is whether it's symptomatic associated with joint damage or it's not associated with joint damage. That is asymptomatic versus symptomatic osteoarthritis. Another way is the extent and pattern of joint involvement. As we know that it's basically the mechanism is such that it starts with cartilage damage and subchondral bone collapse, and gradually from center it spreads towards the periphery, and there is new bone formation, like for example osteocytes are formed around the joint in the peripheral area of the joint, if that has occurred or not. In this we can divide it in terms of localized versus generalized osteoarthritis. Now another is the type of bone reaction. As we know that once the bone collapses, the bones and cartilage gets eroded, the bone ends are exposed and there is actually new bone formation, and usually occur around the edges of peripheral rims. So kind of a type bone reaction, for example, increased osteophyte formation or there was no osteophyte formation. On this basis, osteoarthritis can also be divided into hypertrophic versus atrophic osteoarthritis. In hypertrophic form, there was a massive bone formation and reaction, resulting in large number of osteophytes and large size of osteophytes. On the other hand, in atrophic type, there was minimal bone reaction, only there was few osteophytes and there was very of small size. Another way of classifying this is whether the disease process is active, resulting in a progression or not. It is progressive versus inactive osteoarthritis. But if you see, this classification is actually defining a single disease in some way or the other. But now they have divided into a total new classification, and that new classification is based whether it is a sporadic or common form, which is mostly common, and then it is the most frequent type, and other is the varying degree of joint involvement. This is dense atypical forms. Usually they are associated with certain diseases. Common or garden osteoarthritis is most frequent, and it associated with varying degrees of joint involvement and distribution, joint damage and impact on the people's life. Now remember, if the patient can have bilateral knee osteoarthritis, but that does not mean that the patient has the same degree of involvement in the both knees. For example, in right knee, there could be a severe form of changes. It could be grade 3 or 4 osteoarthritis, and in left knee, it would be probably at the grade 0 or grade 1 at this time. So there's a difference. This kind of osteoarthritis is not necessarily it presents in the same intensity and severity in all the joints. It could have a sporadic kind of pattern, that it may be very severe in single joint, it may be slightly severe in other side of the joint, and then it may be absent altogether. Similarly, if a patient has presented with a right knee osteoarthritis, left knee could be totally okay, but if you get an x-ray of the right hip involvement may be there. So that is important, that it's kind of a sporadic and patchy at times, that not necessarily a single joint is involved. It could be that the same joint of the both side could be involved, or it could be the same joint only and then another joint on the same side could be involved at times. In the atypical forms, it is usually associated with joint failure resulting from a number of clear antecedent causes. That is, there is a definite cause. For example, patient may have a rheumatoid arthritis, may have some kind of ankylosing spondylitis, or maybe some kind of a metabolic bone diseases which may predispose joints to increased wear and tear and increased biomechanical stresses leading to failure. Now, if you see this diagram, on the left side there is a normal joint, on the right there is an osteoarthritic joint of a knee. What actually happens in osteoarthritis when we are looking at it? What do we see on x-rays or we do diagrams? If you see it over here, this is the femur, this is tibia, and this is a knee. A knee is actually a synovial joint, which means it's a lot of this. This is the capsule, inside is bathed by synovial fluid, and this is the cartilage which is present. Once the cartilage erosion starts, this would result the subchondral bone which is lying just beneath the cartilage starts to erode. And if that has collapsed, now cartilage is not strong enough to hold it. So what happens is there's a cracks and fissures formation in the cartilage leading to rupture. And this, once the cartilage gets ruptured or torn off, what happens is the underlying bone, which is already a collapsed bone, actually gets exposed. And there are certain mechanisms which there are a lot of intermediates which are involved. For example, there are cytokines, interleukins, and so many mediators which are involved actually. And once they are released into the joint, then there is catabolic phase, that there's lysis of the cartilage, and this subchondral bone gets sliced first, and then there is a new bone formation. Now the new bone formation which do occurs would results in a formation of an abnormal bone, which is form of osteophytes. So what do we see on an X-ray or a normal schematic diagram? The cartilage loss results in reduced joint space, as you can appreciate over here. And then there will be osteophyte formation in the periphery of joint. There will be increased synovitis or increased inflammation of the synovium. And due to this, there may be a swelling or increased pressure sensation in the joint. And as a result, overall, the joint becomes weak, swollen, large, with reduced joint space, biomechanical stresses increased, and a lot of osteophytes are formed inside the joint. Thank you very much. Keep watching sqadia.com.